How Did He Give Me HIV Part 13. So I thought I wanted to, at this point, before I go into what actually happened at court, I wanted to talk about the kids, because a lot of people are asking, well, how are the kids doing? Are they okay? And so I wanted to make sure you guys knew what took place with my pregnancy now. So the twins were born March 22nd, 2008. So that means this year they'll be 16 years old. My water broke. I was on bed rest and my water broke. My due date was not until August. And so at 23 weeks and 6 days of being pregnant, my water broke and I was rushed in to have the C-section to deliver them. And of course, you know, the doctors, they're going to let you know, okay, there could be this issue, that issue. They're born early. They're not all the way fully developed in the sense of they're not full term. They were considered micro preemies. A micro preemie is typically babies that are less than 2 pounds in weight. And so they were tiny. I could hold them in the palms of my hand. So Micah and Michelle were born March 22nd, 2008, weighing 1 pound 6 and 1 pound 7 ounces. Michelle stayed in the NICU for 3 months. She came home, and Micah stayed in the hospital for about 9 months. He came home with a lot of different issues. Micah, because he was exposed a lot longer, his water is the one that broke, because they are boy and girl twins. They are not identical, and they were in different sacs. So Michelle's gestational sac was completely intact. Micah's sac ruptured, and so he was exposed to the elements a lot longer than she was, and that is what gave him a lot of the issues and disabilities he had to deal with over the years. So Micah is in a wheelchair. He has cerebral palsy. He's blind in his left eye. He's not able to have a conversation like you and I. He understands completely. However, he's pretty much nonverbal with the exception of a few words that he has learned over the years. Michelle is now on the autism spectrum, and that's mainly because her disability really is from her being born early, but a lot of the resources and the things that she needs to help her along and throughout life fit into the autism category. So she does fit into that category of having an autism diagnosis. They're in school. They're in 10th grade. They have been thriving. They very rarely get sick or have illnesses. Micah takes one medication for seizures, because he started having seizures years later after birth. And at one point they actually told me to pull his plug in the NICU. The doctor told me that there was no miracle that was going to help him, and that there was nothing that they could do for him, because he had ended up having a massive bleed on the brain, and they considered that to be something that they couldn't help or do. And I told that doctor in that moment, I said, well, if you're telling me that there's nothing that you can do, I said, well, then I'm not going to let you do anything. Don't do anything then. If his heart is going to stop, his heart is going to stop. And that is when I'll know that he won't be here. Because I always see like ventilators and breathing machines and oxygen as this thing of, okay, yes, obviously if someone needs help with breathing, they need help with breathing. Their heart is still beating whether they need help with breathing or not. So my whole thing has always been, why deprive them of what they would need to assist them in getting what they need in their body, the oxygen. Now if his heart stops and you're giving him the oxygen, that's not going to matter. His heart is going to stop whether you're doing it or not. So that's why I made it a point to say, no, let him be as is, how he is right now. And if things do change to a point where we do need to intervene and this is not going to be the life that he needs, then, you know, of course. So here we are now 16 years later, and he is not the vegetable that they said that he would be. He's thriving. Michelle is thriving. And I think for me, through these whole 16 years, the saddest part for me is the fact that neither him or his mother or anyone in their family, with the exception of one cousin, has had anything to do with these children. That has been one of my, like, I could get past, you know, what he did to me, but I don't think that it's as easy for me to get past the fact that these children are here. These children were not forced to be here. These children are here because of, at the time, it was something that we were doing as a union of what we had discussed, of having children, you know, in our marriage. And so I'm like, wow, your mom is not doing anything. But you know what? Guess who they are doing something for? They are doing something for this child that he had out of wedlock. This child that this woman had while he and I were married. They're doing something for that child. That child does not want for anything. Now, granted, my kids don't want for anything either, because they have a village. They have a village, whether it's the people that follow us on social media or whether it's my other family or my parents and my sibling. They have a village, so they're not wanting for anything. But the thing is, you would think that the people who are the closest to them in blood would have something to do with them, and they just don't. They don't. And I think that's what bothers me the most. So yeah, that's what bothers me the most. The simple fact that they will do something for a child that was brought into this picture through lies and deceit. You know, but the way I see it, all of the children in this situation are innocent, regardless of how they came into the picture. They're innocent. That baby's innocent. She's 16, as well as my twins are about to be 16, and they're innocent through this whole situation. But I just really wish that he and his mom would have at least taken the time to know these children. That's it. You ain't got to do nothing for them. I feel like time is way more valuable spent than any dollar amount. Like, people don't realize that. You know how much I would have loved to have been able to sit down with some of my ancestors just to talk to them and to know them and build a bond and connection with them. The same thing with these kids. But that's fine. It's fine. It is absolutely fine. So yeah, I wanted to kind of give you guys an update. And when it comes to their status, they're negative, okay? A lot of people ask that question. Yes, a child can be born to a mother who is positive and be born negative. That is possible. If I need to elaborate on that any further, you can ask me in the comments, and I will set aside a time where I can actually explain it and break it down to you. That is what I do. I educate, I share my story, and I break these things down. So if anything throughout these parts that you're hearing you want me to break down, just let me know. Or something you don't understand, let me know, and I got you.